The state of Florida is opening 5 more monoclonal antibody treatment sites, including one here in Jacksonville starting tomorrow. The new site in Duval County will be located at the Southside Senior Center. That's on Beach Boulevard, and it opens at 9 a.m. News4Jax reporter Bree Isom joins us live. Bree, you spoke with a doctor about these antibody treatments.
And he says unless that the treatment available here will be sotrovimab, that's the one that's compatible with the Omicron variant and making those symptoms less severe. He says it's not worth it to get a monoclonal antibody treatment at all. However, it's not clear which treatment will be available here yet. On Tuesday, a second monoclonal treatment site will open in Jacksonville. This after Governor Ron DeSantis called on the federal government to increase the supply of antibody treatments for COVID-19. He announced he's received 15,000 additional doses of Regeneron for new treatment sites in Florida. This new location at the Southside Senior Center is in addition to the Regeneron Treatment Center at the Joseph Lee Center. Dr. Jonathan Cantor, a scholar at the Penn Center for Global Health, says Regeneron can work to prevent serious infection with the Delta variant, but it's not been proven to be effective against Omicron.
One of the reasons Omicron is so concerning is because it has such a large number of mutations. And what these all do a little bit, if you think about you can think about the virus as the lock, for example. So if it's all those mutations slightly change where the pins are in the lock, then the antibody, which is the key, might not fit quite as well.
Dr. Cantor says the only antibody treatment to work against the Omicron variant is sotrovimab.
The data that we're seeing now is suggesting that sotrovimab would be the monoclonal antibody of choice to use, and that, it may not even be worthwhile to treat with monoclonal antibodies if you're not going to be using that one when treating Omicron.
And Dr. Cantor says finding this form of treatment has been difficult across the U.S.
A number of states have basically been trying to ration their sotrovimab for those patients who could benefit the most from it. So, for example, those who are immune suppressed, those who are very elderly, have multiple medical conditions, those who you would expect to really have a lot of trouble fighting that virus on their own.
While companies like Regeneron and Eli Lilly say they can quickly develop new Omicron targeting antibodies, those aren't expected to launch for at least several months. Now, this site will open tomorrow from 9 o'clock and it will close at 5 o'clock tomorrow night. Now, coming up at 11, why the doctor I spoke to isn't positive that all of these monoclonal antibodies actually work treating COVID-19 despite the variant.